Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Here we are, Dr. Mencia. Good morning.
Oh my God, what a beautiful morning.
Yes, it is a beautiful morning, and you look beautiful as usual.
And I say, if I stay home, will Anita call from her house and I call from my house?
No way.
And we do a show, but without seeing your face, it's
same
not the
for me.
same.
It isn't the same. I have a lot
you.
of people that are on the show, and when they come here, it's a different show. But sometimes there's an
So
emergency.
you like my jacket?
Oh, I want to know what the little red, it's like you're a bullfighter almost, those little red
right.
things on your jacket.
I just need the...
Yeah, no, and the red pockets. I mean, you are just out of Esquire magazine. That's fantastic.
I just need the flower in my mouth.
Flower, yes. Well, you're the flower. You're the flower. I wanted to talk about something that seems so important. We hear all the time, Dr. Mencia, that people should be exercising. But that's an easy word. What does exercise really mean to this person or that person?
Well, the key is being active. You know, some people live most of their time in a wheelchair, and so they cannot go jogging, they cannot go cycling, they might not even be able to go swimming, but they remain active. And as a scientist, I always try to look at people's blood tests and pair them with what was my expectation, what was I hoping to see. So, for example, I might see an obese person, and most people out there would think if you are overweight, most likely your cholesterol is out of whack. And if you are very skinny, most likely your cholesterol is perfect. And that is not so. It's not true. You get a lot of people that are overweight, and I tell them, your cholesterol is perfect. You don't have a problem there. Now, and a very skinny person might have very bad cholesterol. And the difference might be that the skinny person might be 68 years old, and the obese person might be 39. So what that is telling us is that our genes, the way the genes are coded and programmed, it's like a clock. When you get the clock to work the first time, now we just put battery, we used to wind the clock. You get the clock to start working. When the clock is brand new, when you have a brand new bicycle, you can do all kind of things with the bicycle. And the clock works perfectly, time is great. But as time goes on, then that bicycle, you are not able to do the kind of thing you used to do with a bike. You know, jump off from the sidewalk into the street with the bike. You know, the bike won't tolerate that anymore. You know, it's getting older. So the genes in our body are like any object that we have at home that we use, a blender, anything that we use over time, eventually start asking for maintenance. And the body, we tend to neglect our body when it comes to maintenance. We need to understand that the liver right now, you can go to one of those fast food and eat a load of French fry that had been deep fried and have thousands of calories in cholesterol, bad cholesterol. And your liver is so powerful at this point in time of your life that you can handle that. But as you get older, then those enzymes are not able to handle the amount of fat that you are taking. And that's when we need to start making modification. And of course, the sooner we make those modifications, the better for us. So being overweight doesn't mean that your blood test is bad, and being skinny doesn't mean that you have perfect blood tests and you don't need to get checked anymore. In both scenarios, you can have a really bad outcome when you look at the blood test and the consequences of those abnormal lab that we have, check on. For example, you can have a very skinny person that I have a lady, she's a vegetarian, and she came to me and she doesn't take any supplement, anything like that. Very skinny. Her BMI, body mass index, is 19.2. Very low.
Wow.
It's like, wow, you're a model of a patient. But when you look at her cholesterol, it was extremely abnormal. Her good cholesterol was very low, and her bad cholesterol was high. So I said, we have to start supplementing. She doesn't eat a lot of fish. She eats some red meat. So I say, instead of red meat, maybe you have to start doing salmon. But I'm not the expert with diet. So I'm going to have you see one of the dietitians to work with you so that we can start adjusting your diet and start working on your exercise regimen. And this was about 2 months ago. And she wanted to procrastinate. She said, can we wait after the family leave back up north and then we do it? I said, well, let's look at the whole picture. Your father died in his early 50s. You have uncles that already died in the early 60s. You already hit your father's age. So you are already there, which means that genetically you are predisposed of having problems. And now that you are on my watch, what we want to do, you and I, we're going to be proactive. And let's do everything that we can. So, I am a grandmaster in Taekwondo. So I set up an exercise regimen for her. I said, I cannot be your coach because I'm a doctor. But I will tell you the kind of thing I would recommend for you to do. And one of the things, when she came to see me, she has her walking sneaker, quote unquote. These are my walking sneakers. And I look at her sneakers. They look like 20 years old. So I say, how old are your sneakers? And she goes, I had it forever. I love the sneakers. They are great. And I say, I see that. I say, you need new sneakers. If you're going to start exercising, you gotta invest in yourself now. I want you to get new sneakers so that when you go for a walk, okay, your body, the cushion that you have lost on the sole of your feet, can be supported by the new sneakers, and that way when you exercise, I don't want you to go out there and feel pain. I want you to go and do things that will make you happy. What makes you happy? So she asked me, what makes you happy? And I say, having a beautiful lady like you walking with me by the beach, that makes me happy. So she say, I love that. I love walking by the beach. I said, then get a nice pair of sneakers, go and walk by the beach. Make you do something. Don't go on a gym. And that's the key of this topic today. You don't have to go on a gym and spend money that most of us don't even use the gym, the membership. Don't go in a gym to spend money. That doesn't make you happy. If walking in a park, and we have so many parks here in Florida, if walking in a park, walking by the beach, having a companion, somebody that you can relate to and talk to, your business partner, your best friend.
Or get a dog.
Or get a pet, right? But not a pet that is pulling you all over, okay?
But that forces you to walk.
Right, but then they like to stop and,
I see. So it's
you're
not
doing
exercise.
it for you.
Okay,
it's not exercise. It's something that you're really doing for you. And according to Chinese philosophy, when you look at the yin yang, when we are young, we are full of energy, and we leave the outside world. We dress for the outside world. We have all this energy, all this aura as a young person. When we get older, if you notice, when you are young, you can look from here 2 miles ahead and read a sign. As we get older, your sign now get closer and closer. what the universe is telling you as you age, concentrate more on yourself. Stop looking on the outside. That's why your eyes are the way they are. That's why as we age, we are unable to read a sign when you drive in the car that is too far away from you, because you are not supposed to. You're supposed to concentrate more in your surrounding. What is around you? What is the here and now? And when we do that, now you are working on the psyche. You're working on the mind. You're working on your soul. So part of exercising, any exercise regimen routine that we do, it have to have you included in it. You are not doing for anybody else. You know, you want to walk fast. You feel like walking slow. You feel like stopping. You want to talk. You don't want to talk. Just do something that makes you happy. You know, I recall I used to do a lot of walking on A1A. And I used to go just walking and talk business. So a lot of people wanted, you know, they say, oh, Dr. Mencia, can we see you in like 15, 20 minutes of your time? I say, I'll give you half an hour, maybe 45 minutes.
But we're going to walk.
But we're going to walk and talk.
That's a very good idea.
So people will come with me and say, you know, just bring your walking sneakers. You know, people will come and we will talk about business idea, projects, where we want to go. And then when I get home, I will sit down and write down, you know, ideas and what have you.
I want to tell everyone you're listening to something very special, as usual, Dr. Andy Mencia. And Dr. Mencia is the founder of the Adult and Geriatric Medical Center, which is in Broward County. It's on East Commercial Boulevard, 1608 East Commercial Boulevard. And this is really very much how Dr. Mencia runs his medical practice. He has a lot of practitioners there with him, from the dental to the ophthalmologist, the neurologist, the cardiologist, and so many other people. The most important thing we were talking about was the dietitian and nutritionist also. But the important part of this is that you are going to get this kind of care when you go there. You'll always see Dr. Mencia, and then you'll be turned over to other people depending on what your needs are for an appointment. And he is open on Saturdays. That's why we rushes out of here at 7:30. They're open every Saturday. And they are also, the nice thing is, if you are homebound, if you just can't get out, they do have home visit services. So the phone number is 954-489-1345. That's 954-489-1345. Dr. Mencia, I want to continue with what you were saying. I live in a 14-story condominium now. We sold our house, and there are we're on the 7th floor. I have thought very seriously about not taking the elevator anymore, going up and down the 7 floors. Is that dangerous? I mean, I'm not. Should I be using the stairs?
Yes, the way I would do it, probably I will do 2 flights and maybe take the elevator and see how I feel.
Oh, work up for it.
And work up for it. And then do 3 flights. Because, you know, for the audience out there, they might say, I'm not gonna do 7 stairs. I live on a 9th floor. I'm not gonna do that. Of course you are not, you know. But you can work up to maybe 2. Some people might not even get to 5, but that's okay. At least you got to 4. So you can walk 4 flights and take the elevator for the other 5 if you live on the 9th.
But is that a good exercise? Isn't going up and down stairs a good exercise?
One more time. What makes you happy? What makes Anita happy? If Anita is claustrophobic and get panicked walking on a stair, there's nobody there, and it don't bring you happiness, don't do it.
I see that.
Know, if you see that you are in a place that is open, there are glasses, and just walking up the stairs, it's a nice scenery, and you are enjoying that, then why not? What makes you happy? Some people might say, well, you know, to me, it makes me happy just laying down in my recliner.
Right. That's no.
We are talking about activity. What kind of activity you can do that makes you happy? And even in my apartment here, I have a recliner, and I sit on the recliner, but I do my stretching sometimes when I'm there. So I get on the recliner.
Stretching on a recliner.
I grab my knee and I bring my knee as close as I can to me. And then I grab the other leg and bring it close. And then I take one leg and put it down as if I'm sitting on a regular chair. So it's now bigger stretching. And then I grab the counterlateral leg and pull the knee toward me. And then I start to open from side to side. And I grab my elbow and pull my elbow while I'm doing that. So I'm moving muscle as I'm sitting on the recliner. And the recliner, what it's doing to me is taking my back and at least giving me a good support for my back. So if you are one of those persons that have back problem, talk to your doctor. And if you don't have a doctor that talk to you about exercise, come and see us. But talk to your doctor. But the key, if you have back problem, is stability of the area. You know, we learned that on the ABC of first aid since we were in the Boy Scout. So stability of the area. If it's a broken bone, we want to stabilize that the area where the broken bone is. If it's a part that is hurting you, your lower back, your hip or your knee or your shoulder, you want to stabilize that area when you are exercising. So if it's your back, you want a position that you can get a very good support from either the lazy boy chair or the floor. Get a good support of your back and then start doing the exercises. So to give you an example, if you have lower back problem, a regular bicycle might be detrimental to your lower back. But those recline bikes, they are excellent. They are excellent for people with lower back problem. Because if you ever see next time you see one of those, go and try them. It's just all the leg, but your back is well supported. So your back is not even moving. It's only your lower extremity. Your legs are making the motion, but your upper body is stable. It's not moving a hair. So it gives you stability on your lower back and you still moving your leg. So what that means, if you are moving muscle, you are burning calorie. If you are burning calorie, you're going to be in great shape.
Okay, well, I want to move. What you've been talking about, a lot of it applies to me because I really am in a lot of energy. I'm in good shape, the whole thing, and I have longevity genes. My mother lived to 94, my aunts. But you know what? I'm really now going to work on a whole new exercise regime now that you and I are talking. But I want to talk about the people in wheelchairs. I want to talk about the people, you started out that way, who could exercise even in a wheelchair in some way. So tell us, for those people who are sedentary, who because of various problems, they're in a wheelchair, would it be the weights? What could they do in a wheelchair?
Well, the question is, what part of the body are they unable to move? So let's say they are on a wheelchair because they have a stroke that paralyzed the right side of the lower extremity, and the left side of the lower extremity became so weak that now they need to use a wheelchair. What that means is at one point in their life, when they struck out and they lost their right lower extremity, they didn't compensate with the left lower extremity. Because if you compensate, a lot of people, when they are handicapped, if they have no use of both lower extremity, you see their shoulders are very wide, very well built up, because they have to propel themselves in the wheelchair. They are always active, so the upward part of their body is huge. And you can do the same thing if you have weakness on one side of your leg. If you have a little bit of arthritis on one side of the leg, you need to start working on the muscle around the joint to build them up and to maintain your muscle mass, because we're going to lose muscle mass as we age. And then work on the compensating extremity, the counterlateral extremity, to compensate. So there are many exercises you can do sitting on the wheelchair. What you want to make sure is that you have a good cushion. So if for the touch, So even if you don't...
oh, no, excuse me. So wheelchairs don't have the cushions. You have to buy an extra cushion?
Sometimes you don't have a cushion. Sometimes they just have the wheelchair and without the cushion. So if you're going to exercise, you don't want the skin to break. So you want a cushion there. And there are many exercises. You can take a beach ball, and with the leg that you are working on, you step on the beach ball and push on it, and the air is pushing you back.
That's great
that's
idea.
like isometric exercise. You take the leg and you lift your knee up, like I do in my recliner. You can do the same thing on the wheelchair. Lift your leg up without holding it with your hand. See how high you can go. So if it's my leg, I lift up from here, and let's say that's how high it can go. Then I pull it with my hand to get more stretching. So what I do at first, with the first motion, I'm using the muscle to lift up my knee, and then by pulling, I'm stretching the muscle to give me a little bit more support. Okay.
You know, Dr. Mencia, when we do our television show, which we've been talking about,
be great.
That's exactly what we ought to do. We ought to have someone in a wheelchair and show that. I mean, I just love what you just said. That would give people, and it would make them feel more useful.
Of course, and you have to feel useful. You know, there is nobody on earth that God have left here that do not have a purpose in life. And if you believe that God is, is almighty, is so powerful, and love us so much and care for us so much, you can be quadriplegic. And there is a reason why you are here. And you might say, well, quadriplegic, how can that person exercise? You have so many muscles on your face to exercise. And a lot of the Indian technique, a lot of the Indian exercise, they start in the morning by exercising their facial muscle. So the idea is to burn calorie, to remain active. You don't have to do sit-ups and push-up and pull-up and be Charles Atlas. You need to be a person that you must be active. You must do something that you are moving the joints, because joints, arthritis, when people develop arthritis, is lack of fluid between the joint. When the joint dried up, the cartilage will be eaten away because you need water in there. You need fluid. Cartilage disappears, then you have bone touching bone, and now that joint becomes very painful. So just taking your finger and moving your finger like a worm, and taking your wrist and doing small circle with your wrist, taking your elbow and moving your elbow, and taking your shoulder and doing small circle backward, small circle forward, and taking your neck and doing side to side, and then left to right, and so on, and just doing all this joint exercise. And you start working your body as if you are picking up $100 bills and you don't want to leave anything behind. So you don't want to leave any joint behind.
I am watching Dr. Mencia do this, and it's just beautiful. I wish people could actually see the way you're saying it. So let's say someone comes to your practice, and they're in a wheelchair or they're in a walker. And, of course, as a medical professional, you do what you have to do. But then, knowing you, I'm sure you say this to people. Are you exercising? And they'll say, active? And then you help them and you show them some of this, don't you?
Absolutely. The staff will tell you. They see me doing the stretching and putting my leg up and teaching them how to keep the heels above the hips so that they don't collect fluid on the lower extremities. And now that we have Dr. Manny Gonzalez, who is a vascular specialist, I feel that now I can be much more aggressive in preventing lower extremity damage and varicose vein. And the most important, varicose vein, more aesthetic than anything, but still can be problematic. It can be a medical problem. But circulation in general, a lot of us that develop wounds in the leg, it's usually because of poor circulation. And we don't tend to look at the lower extremity when it comes to circulation. We think about the heart And because we have the brain, we think of the carotid artery on the neck and say, oh, I have to check my carotid artery. If you are a smoker, we think of the aneurysm on the abdomen. And just look at the screening that people are doing in a lot of the hospital when they do the vascular screening for $200 or what have you. Usually instead of what the heart and the carotid and the blood pressure, but the lower extremity become very important.
I was very fortunate, Dr. Mencia, about 25 years ago. I think I told you this story, that there was a woman who was in her 70s, and she was a yoga instructor. And she taught me about putting my leg up when I brush my teeth. I told you that story. I raise my leg all the way up, and every day, I'm up and down. And so my legs are very strong. Mm-hmm. And that's probably then when I'm listening to you, very important.
It's so funny because I do the same thing. When I'm brushing my teeth, I have one of those electric toothbrushes that
I got yours, Sonic, right, from your
Sonic,
company. Yeah. I love that.
Yeah, I love that toothbrush. So I use
and I use the Ganoderma toothpaste with my Sonic toothbrush. You're in my life everywhere, but go ahead.
And I do the same thing. I put my leg up and I start brushing, then I change my leg.
I do the same thing.
Then I switch position.
But I've been doing this for 25 years, and that's why, I have such great muscles in my leg, and I think that's helped me, with other things. Yes. So it's true what you said, that yoga, I never understood that yoga was going to be, I always thought it was this little exercise, nothing much, but I can see where it's very good,
intense.
Isn't it?
Yeah, it's very intense and it's really good. And, even yoga is such a, and that's what I say, if you're going to do something you like, and try to do it in such a way that, when you're doing the exercise, that you're not forcing yourself. There's no need to go and try to do an exercise that you are forcing yourself to do. It should be that you want to do it. It should come from you. Right. And remember the philosophical point that I brought to in the show, at the beginning of the show, in case you are tuning in late. When you are young, your vision goes really far. You can see far. As you age, your vision now, when you are 20-year-old, you try to remember when you were 20-year-old driving a car, and you could see the sign way in front of you. And as you get older, then those signs don't become a little bit blurry. The signs that are closer to you are the ones that you can see. So what the universe is telling you, as we age, start looking into yourself. Start looking at you now. Because when we are young, we dress for how the kids are dressing in high school, or when we go to college, we dress for the peer pressure is so big when we are young people.
I know, dress for yourself, and and for your patients, because
But first for me.
Yeah, first for you, and I love it. When I see you.
And that's what people need to do. And when it comes to being active and exercising, do something that will make you feel good. Don't go upstairs and downstairs if you're claustrophobic. If it's going to make you feel bad, if it's going to bring bad feeling to you, it's going to affect your aura. Don't do that. If walking by the beach make you feel great, do it.
You've got to. Well, you're going to have to take a walk to your office because it is now
I would love to.
7:30. We have to let you go. We have Dr. Michael Hughes here. But Dr. Mencia, I'm inspired. I'm coming down later to get my blood pressure checked and start working with you to get myself back in shape.
Excellent.
Thank you very much for being here, always. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.